Please help me welcome Dr. Erin Doyle.
Thank you. Thank you very much, Marianne. How is sound for everyone? Good, okay. I know I can tend to be soft-spoken, so let me know as we go if you have any trouble hearing me, but I'm so flattered at the turnout for this. Thank you guys all for being here. It's only been for the past few years that I've started speaking on like us kind of topics. And I always struggle with the right wording because I feel like well-being and resiliency, like those are important words, but sometimes, I don't know, to my sort of New England droll cynicism, sometimes they sound a little bit saccharine or sometimes it can seem trite. And then on the flip side, talking about the more negative experiences that we can experience sometimes feel too limiting, right? So I went with decision fatigue for this one because that is genuinely what we're gonna focus on. But one passion that I have and why I'm really excited to be here today talking to you guys is helping to support those of us in shelters that are making the decisions, right? That are making the decisions about animals, whatever role that might be and whatever decisions that might be. So when we start to talk about strategies, I will focus in a lot on making outcome decisions for animals and how we're approaching those sorts of decisions. But I think a lot of the same tenets apply for those of you out who are making decisions about people in shelters, personnel, regardless of your role. And what really sparked my interest and why I was really excited to have the opportunity to talk about this at this conference this year, well, first of all, because we're in person and that's nice, but also because we have a behavior track this year. And so, I mean, whether you have behavior in your title or your credentials or not, I think behavior and decision-making related to behavior can be some of the most tough decisions to make and can really, and for those folks that really is one of your major roles is making behavior-related decisions, whether that's because you're a behavior staff member or because you're a shelter manager, because that's your hat that you wear. I really empathize with how that can be really tough. And so I was excited to speak to this crowd this year, and especially for that interest. So I'm going to give you a little more background on me and why, as a veterinarian, I'm here talking to you today about well-being and us related topics. I'll lay down a little bit of the ground rules for how I want to approach this session, kind of in terms of relative level of interactivity or not, and then we'll dig into exactly what we're going to cover. So as Marianne said, I'm a veterinarian. That's my credential, that's my training. I'm not a mental health professional. I have sought out as much as I can kind of glean and get for training in the sphere of social work or in compassion fatigue. Again, all the terms that I think can funnel into talking about us and folks that are doing this work. But that's not my area of expertise, right? Like my area of expertise is veterinary medicine. And so the approach that I take to any of these topics, whether we're talking about compassion fatigue, decision fatigue, anything related to our well-being, tends to be pretty like practical, rooted in the work. And so that's the approach we're going to take. Like when we start I'm going to give you background and we're going to talk strategies, but those strategies, to a large extent are focused in kind of what we're doing at work. And there'll be some touchy-feely stuff related to what we're doing at work. But I say that up front because it's not to discount all of the other things that we can do to support our well-being that are outside of the work. Things like mindfulness, things like breathing exercises, things like, finding some degree of balance or kind of however you'd like to call it to be able to sort of leave work at work. And all of that focus on that is really critical. It's not where we're going to go today. We're going to focus in on like kind of what we bring to the work and to our work day, because again, I think that's where I can speak to with some more with less imposter syndrome, I guess, so to speak. But again, I want to say that up front because I don't want to negate all of the critical aspects of that. Therapy, seeking help outside of the work, but we're going to dig in a little bit more of like an operational focus on this as we go through it. And again, that ties back to why I'm here talking to you today and my lived experience with this topic. So Marianne gave you kind of the highlight of the bio. I started off my career in private practice and then went to work for the Animal Rescue League of Boston, which is getting a lot of airtime at this conference, which is great. And it's fun to have colleagues I mean, for anyone who was at the keynote, the veterinarian for Stanley was me. Not that I remember him in as much detail as Sheila does, but as soon as she showed him up on the screen, I was like, oh yeah, I remember. So that's where a lot of my lived experience with sort of, well, struggling, to be honest, but struggling with how I felt doing this work came from. Because that's when I was at the American League of Boston, I was a clinical veterinarian. Towards the end of my tenure there, I did have some managerial and leadership role, but even during that time, 5 days a week doing clinical shelter medicine. And so what I found while I was there is that, I loved it. I still love shelter medicine. That's why I'm doing it. And at first, switching from private practice to shelter medicine, I think it was very, it was like, aha, like this is my thing, and I was very excited, and I loved it, and again continued to. As I got kind of really in it, there's aspects of it that would keep me awake at night, or that I would ruminate as I would, ruminate at night after I left work. And a lot of that, I think, really was related to the decisions that I was making about animals. And over the course of, I was with the Animal Rescue League for about 11 years, a little less than that. And over the course of my time there, I had the opportunity, and it's great. It's a wonderful, progressive institution. And so we did have compassion fatigue training. That's I think, probably one of the most common names that we give to this, which again, limiting, but we did have compassion fatigue training. So that was great. It's great that they were offering that. And I felt like, and this is not to disparage the folks that were doing that training at all, but I felt like sometimes I would go to those trainings and they would make me feel worse. And I think because sometimes a lot of the focus at those trainings was about how hard it is to face euthanasia and how hard it is to not be able to save everyone. And to be honest, I feel like from my perspective as a shelter veterinarian, I mean, don't get me wrong, I'm not a monster. I obviously do want to help animals. That's why we're all here. But I didn't find that was what was keeping me awake at night. I had a pretty good, I felt like we were doing net good for the animals. I wasn't necessarily feeling despair. And this is Boston, and as Sheila said last night, even back in the day when I was there, we were lucky with some degree of resources. So that's my unique perspective, and that's based on where I was working. But if I would go to compassion fatigue sessions, and then I wasn't really up awake at night feeling stressed that I couldn't save them all, because I felt like we were doing pretty good work in that area, then I would feel like, oh gosh, am I a monster? Do I not care about animals? And in turn, when I was then with colleagues who were perhaps in direct care roles or in roles that were having sort of decisions put upon them, then I would also feel bad because oh God, and then I'm making them feel bad. So am I cold and dead inside because I'm not staying up awake at night about all of the animals that maybe I wasn't able to place? And then I'm making everybody else feel worse at the decisions that I'm making. And I realized what was keeping me awake at night when I was struggling with work was things related to those decisions. So sometimes feeling questioned, and questioned not in a out of curiosity, but questioned people didn't trust the decisions that I was making, or sometimes feeling I wasn't valued in the what I brought to those decisions. And so it really highlighted for me, and what I'm saying may resonate with you, or it totally might not, and that's good. I mean, it's individual, right, what we bring to these conversations. But in talking with colleagues, and then in shifting to my work with the ASPCA about 4 years ago, I'm now in a position that I'm not doing day-to-day clinical work anymore, but I'm supporting the folks that are, two of whom I get the luxury of presenting with tomorrow. And so I was hearing some of the same thoughts echoed, that they were feeling some different stressors. And this is not just veterinarians, this is the folks that were making the behavior decisions, the folks in leadership positions, feeling some of the same echoes, that there were some different stressors on the decision makers. There's overlap, there's individuality, but it really kind of continued to spark my passion, both from knowing what I was experiencing when I was at the ARL, making, kind of doing this work, making these decisions myself, and then supporting folks, continued to spark my passion in kind of talking about this out loud and bringing kind of my experience from being in the trenches, and then getting the opportunity to step back a little bit and be more of someone who supports the folks that are doing it, And so that's why we are here today. And again, thank you all for being here with me to talk about this. Few ground rules, and then we're going to we'll actually talk about the stuff, I promise. So a few ground rules for sort of how we're going to approach this. I love to have interactivity when I talk. I feel like the Q&A part oftentimes, is one of where some of the best stuff comes out, and I certainly hear that echoed in some of the sessions that I've been in today. The wonderful talks, and then the questions bring it all the more, bring out all the more interesting stuff. That said, and again, I'm not trying to throw other folks that have led compassion fatigue sessions that I've been in under the bus, but in the past, I feel like sometimes I've walked away from sessions feeling like I shared stuff that I don't know, was it like a little bit of not the format that I really felt comfortable to share? And so along those lines, there is going to be interactivity. Some of it will be like out loud, but that's not going to be the personal stuff, and even that, no offense taken if you want to opt out. There are going to be a couple of online polls, if all works as planned, to ask, no one need give deep personal details, but the stuff that is a little bit, I think, potentially more personal, that's how we'll do that. So I just wanted to say that out loud in case anyone felt like you were going to be asked to divulge or share or anything like that. And then at the very end, there'll be a little bit of sort of independent work, kind of thinking about takeaways, and an optional sort of sharing with some of the folks that are around you. But again, just to lay the groundwork that I even though we are talking about us, we're talking about how we feel about this work. I want to be thoughtful that this as a format is not necessarily the most comfortable format to share your deepest, darkest secrets. If you feel inclined, definitely feel free. Interactivity is great, but I certainly would not want anyone to feel uncomfortable. So, all right, with that said, what are we actually going to do today? So we are going to focus in on decision fatigue. Again, it'll be a little bit more holistic than that, but I want you to walk away from today recognizing the signs of decision fatigue in yourself and the impact. Because I think that's half the battle, really, is just kind of acknowledging it and recognizing that you're feeling it. I want you to walk away being able to identify, okay, what are the root causes of this, and the other challenges to our well-being in our work, and some strategies to support your well-being. Definitely do not have the magic solution, so I'll lay that groundwork up front, but hopefully in offering sort of a kind of smorgasbord of strategies, and again, these are very work-based strategies, I would love for folks to be able to walk away with something practical and useful that you can apply. All right, so first, forced participation, which is hopefully not too personal, but if this is, you can totally opt out. I wasn't going to ask everybody's roles because it's such a, everybody's coming from very different organizations and has different, your job title may be very different, and it may not totally reflect, and a lot of the decisions we're making they take into account the whole animal anyway. So long story short, I'm not going to ask roles, even though I debate about that, but I am curious about how long you all have been doing this work. And when I say work, it could be getting paid for it or volunteering within this field, because I think how long we've been doing it does impact how it makes us feel. It can be both for the positive and for the negative. So we're gonna do this wedding dance style, when they have the couples dancing and everybody sits down as you've been married, and you end up with the couple dancing that's been married the longest. No dancing, to be clear. No one needs to dance. I saw some worried looks that is not the partner exercise. But I would love for folks to raise your hand if you have been doing this work for at least a week, in case there's any newbies in the crowd. All right, so keep your hands raised if you've been doing this work, and again, volunteering, anything in the animal welfare sphere, for at least a year. Okay, good. Maybe this is telling. All right, 5 years. 10 years. 15. All right, 20. All right, I'm not going to make you all keep going. I don't want to put, if anyone who still has hands up wants to shout out how long you've been doing it, now's your chance.
22.
Nice.
23.
Awesome.
27.
Nice. All right, round of applause. Cool. It's helpful just to get like a feel. So I think it's, okay, our experiences doing the work are so influenced by so many things, right? Like we're all very individual people bringing ourselves to this work. We're all working at organizations that obviously there's some common ground, but that look very different in terms of what you're doing. But I think, I think there's some interesting corollary with how long we've all been doing this and how we sort of feel about what we're doing it. So I was just intrigued and also just felt like it was kind of a fun warm up to do to get everybody engaged. All right, so our next participation is diving into our online polls. So hopefully this works for everyone. So if you use that QR code, or if it's not working for you, you can use the link down at the bottom, which seems like that would be kind of a pain to type in. So hopefully the QR code works for you all. And that is going to bring you to a Menti poll that asks you, I think I limited it to like a word or 3 words of what does it feel like to work in our field? And you can take that like any direction you want to take it. You can, I think, submit multiple answers. I'm gonna switch over. Where this is gonna lead us to is a word cloud. So I see some I'll wait till sort of looks like everybody's kind of got their phones type in, and then I'll switch over to the results. In theory. Oh, yep. These word clouds, oops, I don't know how to make the little Mentimeter thing go away. But I find like odd joy from word clouds. Like I just feel like they're kind of pretty and somewhat impactful, but we'll let it keep like hopping around and moving for a little bit. I'm breathing a little bit of a sigh of relief because this is coming out how I was thinking. This is kind of what I thought we might be heading towards, is this like balance, right? There's rewarding, there's empowered, exciting. Things are moving, so it's hard to read that fast. But also exhausting, also challenging, unrelenting. That was a powerful choice. All right, looks like we're kind of controlled chaos. I like that. The chaotic, stressful imposters is I like that. Cool. Thank you all for indulging. So again, I think it just highlights all the complex set of stuff that comes with our work. And so that's kind of where I was going with that. So fair warning, you're gonna have one more poll further down the line, but you can, late breaking news. We can see what's coming in. Not like work. Well, yeah, so a nice balance that. So there'll be another one down the road, but you can rest easy if the participation points make you less comfortable, because we will come back to me just talking at you for just a little bit more. But so it's a mix. But I mean, focusing in on what's tough. I mean, you guys are all doing this, and you've all been doing it, for a little while now for most of you. So this is, you know all this, right? Our work is fast-paced. We're not all in this field to get rich, right? This is not anyone's choice in terms of so we can get our fancy yachts. There's a lot of stakeholders, right? And I think that gets to some degree of what I referenced in terms of like what I would be ruminating on after work, was feeling like there was a lot of people maybe judging my decisions or not trusting them. We have a lot of folks that are impacted by what we do. We have our boards. If we're in a municipal shelter, we have our municipality. We have our volunteers. We have our staff. We have our adopters. We have the public. So there's a lot of folks with eyes on what we're doing. We have frequent exposure to the pain of others. That's the animals and the people. And that really, I think for anyone who has been to a compassion fatigue session in the past, I think that's definitely a really key part of that aspect of what can impair our well-being. We do high stakes stuff, right? I think, when we make decisions, when we do things, whether it be, treatment decisions, surgery, behavior modification, there's all big impact to that. That impacts, we are in a position where if we make a mistake or a judgment call that doesn't go well, that can impact the life of an animal, right? And that has weight to it. And of course, the stakes that has for the people. We can make decisions that result in somebody being unsafe or getting bit, right? And so that's high stakes. We come with a passion for the work, right? Like that's reflected in all the wonderful things that we feel about the work. But inherently, I think that makes it a little harder to step away from it or to lessen the impact of it, which in turn, we are in work that has a strong emotional impact. And so this concept, I will give credit to Jessica Dolce, who is an amazing, many of you are probably already familiar, but is an amazing compassion fatigue speaker. And I highly recommend her programs. And so while this is not poached directly from her, she was kind of first who I really had an aha moment sort of in terms of this interconnectivity. So I think it's important for us to level set our work and what we've chosen as a career for ourselves, right? We have the tremendous opportunity in our work, and it's reflected by what many of you said, to make a difference. We do important, good stuff, and we reap the reward from that. We have jobs that can be incredibly rewarding, that there can be tremendous satisfaction from doing. But inherent with that, because you can't separate them, it means that we're investing emotionally. And so it means we have jobs that set us up to have that emotional impact, right? And I don't say that to say, well, okay, let's throw our hands up in the air. It's just gonna suck. It's gonna be hard, and there's nothing we can do about it. But it does mean that if we look at other professions and friends, colleagues, family that are in other professions that don't have as much opportunity to make as much impact. Perhaps they're professions that are a little bit more, we work in jobs that sometimes we want to hide what we do so that we don't hear all the stories about people's, pets and various things that they bring to us. But generally speaking, if we say what we do, we feel proud. And that's a really great thing to have in our profession. But because of that, because we make a difference, we inherently are going to feel that impact. And that's really good, and that can be hard. And it doesn't mean that the hard should be toxic, but I think it's important to set the expectation that we are going to have jobs that sometimes make us feel sad. And that's because we have jobs that sometimes make us feel really rewarded and really happy. And those go hand in hand. And so I think setting that expectation, for me, at least personally, I think that was a little bit of a helpful aha moment to recognize that there is choice in this, and there is choice to make that impact, and that choice also comes with feeling that impact. And so we can work to keep that sadness, keep the hard parts from being fatiguing, and keep them from becoming sort of chronic and toxic for us. But we can't take it away. We can't take away the fact that there are hard parts to our job, and there is loss inherent in our job, because that goes hand in hand with all of the reward that can come from our jobs. So before going further, let's talk about some terminology, because there's a lot of different terminology that gets thrown out there. And I mentioned this a little bit at the fore, I struggle with what terminology is best to use when I'm prepping a session like this, because they are interconnected. But I wanted to just kind of clarify, put a little bit of distinction between different things. And the first one is what we've been talking about in a positive way. Compassion satisfaction is that joy and that sense of achievement from doing this work that really positively impacts others and helps others. Compassion fatigue is the flip side of that. It's being exposed to pain and to distress in others, and what that sort of secondary impact on us from being around that and taking on the burden and the pain of others. Secondary traumatic stress is another term that can either be used interchangeably with compassion fatigue or sometimes can mean it in a more acute way. There's going to be one study I'm going to highlight later on that secondary traumatic stress is what they are looking at. But but they can be used interchangeably. And again, I'm not a mental health professional, so this just comes from kind of what I've read and learned. But I think it's been kind of helpful to dig into what the terms mean so that I can have some awareness and pass that on to you. Burnout is something that I identify with, and perhaps many of you do too. Burnout is a little different in that burnout can be more general. Burnout isn't just for those of us in like the helping and caring professions. Burnout is induced by the environment that we are in. So when we're talking work, it's induced by just this excessive and prolonged stress, just feeling exhausted with that. I associate it as somebody who is a stressy crier. I associate with that feeling when you like are just so overwhelmed and done that like you have a hard time not like having your voice break as you're talking because you're just done. And sometimes, and this is when it takes on a little bit, again, it's excessive and prolonged. But certainly I feel like this is very common in our field and something that quite, personally I have identified with in the past. Moral distress is when you are in a position where you have to do something that essentially you don't believe in or you don't feel is right. So the most common example of this that I have heard used in our field is if you are being asked to euthanize an animal or make a euthanasia decision and you don't think it's right. You think that we could have pursued treatment, we could have found a positive outcome. As somebody who has had the, some luxury of working in shelters in New England and now with the ASPCA working with New York City and having some luxury of resources and not being in that position, thankfully, very often, I would also say the flip can be true too. Placing an animal, going forward with an animal that you don't feel that's right, you don't feel that's safe, you don't think that's in their welfare. So moral distress can go both ways in that regard. And it doesn't have to be tied to euthanasia, but I think a lot of the times when we're talking about some of our harder decisions, they can be tied to euthanasia decisions. Again, both directions. And then the topic of the 2 hours, decision fatigue. And that is this erosion in willpower when you are just having to make decisions all the time. And so decision fatigue, it's funny, when I've been telling folks, like colleagues and friends that I've been talking about this, I get different examples of what pops into their head when they think decision fatigue. And so we are going to focus in and we talk strategies on those like outcome decisions for animals, but decision fatigue is a very broad kind of topic, and it certainly isn't limited to work and to decisions at work. I feel like for a little while it was I definitely heard podcasts about decision fatigue, like it was sort of out there, and I think you get it can be talked about in all sorts of different directions. Like there was, for some reason I remember a podcast, there was a study about jams, and maybe this was in the UK because I feel like that seems like that would be a more jam-centered location, but where basically like when given too many selections, people had a hard time choosing. And sometimes decision fatigue comes up in our work when we're talking about like our adoption floors and how many animals we have available for adoption, and that it actually doesn't increase the likelihood that an adoption will happen if you have more animals. That's not the type of decision, that's not how we're going to focus on it today, but just to throw that out there, that decision fatigue can be a pretty broadly applied term. But how we're going to focus in on it is basically that being in a position to decide things all the time and how that wears you down. I don't know if anyone has read Obama's autobiography or heard him speak, but it kind of goes hand in hand with him. I remember him talking about how he does not ever like choose his clothes in the morning. He just has them set for each day. So that is like one less decision that had to be made while he was president. And so that's the direction we're heading. We're not going to, you've got that tip. Consider that a strategy. Consider that a strategy. That's not where we're going to focus in, but that's a little bit more related to how we're going today. But a key thing to this, they're not mutually exclusive, right? You might hear that list run down and some things might resonate with you. Some things may be like, that's not really quite so much what I've experienced. And they might change over time, right? It might change with what role you're in. It might change with what's happening with your intake pressures and with your work and with your staffing. They're not mutually exclusive, and they are all real and significant. And then when I go back to kind of where sometimes I would leave compassion fatigue sessions feeling worse rather than better, because personally I feel like when I was in clinical practice, experienced a little bit more burnout and decision fatigue than I did compassion fatigue. That was my own personal experience. I would sometimes feel like my stressors were less than. compared to the folks that were feeling more compassion fatigue. And it all counts just the same, right? Like there's varying great degrees of all of them. They're not distinct from one another, and they all count just as much in being real and significant. So, shout out to Scrubs, which is an awesome show. And actually, I joke, but there's actually stuff on like this sort of thing in Scrubs about like the well-being of being in the medical profession. But obviously that's up there because I'm going to highlight just 2 studies and not in any great depth. But the reason why is I find it somewhat helpful to pull a little bit out of my day-to-day or out of the day-to-day to look a little bit bigger picture, to put some perspective on it. And I also find it helpful to remember that we're not alone in this profession-wise, right? Like there are plenty of other professions that are feeling a lot of the same things that we are feeling. It's different because their work is different, but certainly our human medical colleagues, our judges, our teachers, there's a lot of other folks that talk about and go through a lot of the same things. And I don't bring that up to minimize the way that our work can be hard, but I think sometimes focusing too much in on how the negative impacts of being in animal welfare, being in veterinary medicine can catastrophize it a little bit and make it feel like, well, shoot, I just made a horrible choice. Like, well, I went to vet school, I made that choice, but whoa. And I think sometimes if we focus too much in on our work as a unique entity and being hard, again, it can just feel like we have to just throw our hands up in the air or we don't have any choice in the matter. Whereas in fact, we're not alone in going through this. And again, that doesn't minimize where our work can be tough, but it just helps to put it in perspective that we are also experiencing things that colleagues in other professions do too. And so there are, different work out there looking at decision fatigue in different professions. There was one that I think that I heard about, hit the news or was in a podcast or something, looking at judges and how they made decisions like over the course of a day. But this particular paper looks at human surgeons and their decision making. And what it shows, and I haven't read through the whole paper in a while, so I would be lost to speak to a ton of specifics, but I think it just helps to reinforce the feeling that resonates with how I've experienced this. That basically what this is showing, that over the course of a day, and the decision that was being made was the decision to operate. And so for a surgeon, that's the big, bold decision, right? To decide to operate. And sometimes that's just the right decision. Sometimes there is just a right or wrong decision whether to operate or not. But that's the bolder decision. That's like the decision that has more impact, is to take a patient to surgery. And so the surgeons made that decision, that bigger, bolder decision to operate, more when they were fresh. So at the beginning of the day, a little bit like after a break in the middle of the day, but as the day went on, they would decide to operate less. And again, sometimes that's going to be because that's better off for the patient not to operate. But it shows just that making that hard decision, making the decision that has more impact, that might be kind of the bolder decision to make, is harder after you're fatigued or after you've had to make a lot of decisions. So, crowd participation time, and I will try to be good about repeating what you say so that I can be thoughtful of the folks watching this on the recording. What decisions do come to mind on our end that are that bigger, bolder decision? Where do you feel like what could decision fatigue look like for us? Basically, what decisions, how would it manifest similar to the surgeons deciding to operate or not?
I would say for us is we're a receiving facility, so picking and choosing from those lists from our partners.
Oh, that's a great example. So the example was choosing which animals to intake when you're transferring in. Yeah.
Well, the other day, I'm thinking of taking in a stray animal, for example, that might reportedly have a lot of issues. It was 4:45 in the afternoon, the end of a very long day, I feel like I'm a lot less inclined to say, sure, bring it in.
Mm-hmm. Yeah, I love the direction going towards the intake decisions. So I think oftentimes my head goes towards the outcome side, but the intake part are huge decisions to make as well. And so that example, yeah, deciding whether to bring in that stray animal and go ahead and like do that is really much harder when you're at the end of a fatiguing day and you're fatigued. Yeah.
I'd say in veterinarian and shelter municipal open admission and overfull is we get a lot of hit by cars and injured animals. Starvation is which ones can I save?
Mm-hmm.
Why do I go?
Yep.
Knowing there may be an owner attached, how far do I bring it based on the resources, which are pretty much based on donations. So
Mm-hmm.
it's an everyday most of the time for the decision to be made in the midst of just maintaining my own population and my own internal surgeries.
Yep. Absolutely. So that decision of, basically who to treat and who to make, euthanasia decisions for is a huge one. Absolutely. Yeah.
Where to spend my time, what should I be focusing on? So as a veterinarian, as a surgeon, as an administrator, what comes first?
Yeah, absolutely. And so that was, where to spend our time, how to prioritize our days. Absolutely. Yeah.
I was going to say staffing decisions, like trying to balance the budget with, being able to take care of the animals adequately.
Yeah,
is
absolutely.
tough right now.
Absolutely. So staffing, budgetary decisions, and I will, as a preview, I'm not going to be getting into that a lot in terms of when we talk about operational stuff. But at the end, definitely, we can pull back on. We can kind of re-talk about anything else that comes up, because I certainly animal-related decisions, deciding about outcomes, deciding about intakes, is just one part of all the decisions we are often asked to make. Yeah.
Decisions about like safety net programs, who we can help and who we can't help.
Yeah.
We can't help them all.
Yep. Yeah. Decisions about how to offer services like, client-facing services like Safety Net is a great example. Cool. Thank you all. Yeah, I mean, this is great. And this is why I love audience participation, because I think because of my experience, I think I probably, have worked as a veterinarian. So my head goes towards that decision about who to euthanize, who to pursue treatment for, how to make those sorts of decisions. And yet that's just one small piece of all the decisions that we're making in terms of deciding how to prioritize our time, who to take into our care, what decisions to make. So thank you all. Perfect. So one other study, just to throw out there, because again, this is sharing all my stuff to bring with you guys, but similar to feeling in the past, like maybe I've had to feel a little bit of apologetic because I was feeling more burnout rather than compassion fatigue. I've also felt like have to sort of caveat and apologize for feeling stressed when I've worked in shelters that have had pretty high live release rates, or that we've had the option to pursue treatment for a lot of animals that I knew many of my colleagues weren't in the position to be able to do that. And also, even though I've always worked in the Northeast, in the relative scheme of resources, I've been in a relatively resource-rich situation. I have been doing this long enough to have experienced quite a strong arc in terms of who we are in a position now of treating and adopting out. And I didn't find that made it easier on me. Like, I felt like it didn't necessarily get easier as we were able to put more resources towards individual animals, as we were adopting out the cats with lower urinary tract disease and the cats with diabetes. And apologies, my head always goes to feline medicine when given the choice. So all of my examples oftentimes tend towards the cats, which they deserve some spotlight, so that's fine. So I didn't feel like it was easier, even though I was in a position where I was adopting out animals that I would have been euthanizing 5-10 years previously. And so this is just one study that shows essentially that I am not alone in feeling that way. And so this is comparing some of these impacts on our well-being, some of these negative experiences that we can feel with live release rate. And so in this one study, and this is just one study, but again, to me, it just was helpful because it sort of validated that I wasn't alone in feeling this way, that with a higher live release rate, there was an increase in compassion satisfaction, right? Like, obviously it does feel really rewarding to be able to place animals that we weren't able to previously, especially when we're talking about some of the lower hanging fruit from in our past. But it increased secondary traumatic stress. Actually, it was increasing, which similar to compassion fatigue, it was actually increasing that in the folks that were in this study. And it increased burnout. And that jives with my experience, right? Like, it's essentially, okay, do all the things that you've always been doing, and also treat the diabetic cat, and also manage the separation anxiety and counsel the adopter on it, and also do all of this other stuff. And so sometimes there was just a lot of cumulative work. And also, when you are euthanizing less, it can add weight to each of those decisions. And I love the highlight on intake in the decisions. And I think there's, while this was related to live release rate, again, I think it can go towards the intake side too. If you have the capacity to be transferring in more, which is great. Some programs definitely are doing that haven't always been able to. That puts more pressure on those decisions and figuring it out. Decreased moral injury, and again, that jived with my own experience. So while I have experienced moral distress or moral injury in a higher live release rate setting, in terms of the opposite, being asked to adopt out animals that sometimes didn't quite feel safe or appropriate, in general, that's a feeling that because, knowing that there are colleagues being asked to euthanize animals, that they fully disagree with that, recognizing that distress was something that did go down. This study also found that the well-being of the folks making the euthanasia decisions was more significantly impacted than actually the folks doing the euthanasia. And that's not to minimize the impact for the folks that are being asked to do the euthanasia or receive the euthanasia decisions, but it also highlights that we're not alone to feel stressors related to making those decisions. And again, I oftentimes come back towards euthanasia because I think that's a lot of what we're talking about, but recognizing that applies across the board to every decision that we talked about. So recognizing that we're kind of we're at a moment in time, as Sheila highlighted last night, where we've certainly made so much progress in who we're able to care for and place in our shelters, knowing that at this moment in time, right now, it almost, we're feeling a lot of pressure on intake, and it feels it's been a stressful and overwhelming moment in time. But I'm curious, just overarchingly for your career, how has your feeling of your well-being and your work changed over time? And this is going to lead you to a multiple choice answer, so you don't have to come up with another word for a word cloud, I promise. I'm not going to lie, I thought they might be more pretty dramatic bubbling of the dots, but that's okay. We can still see it. So worse over time. I mean, I might have, I know that I just shared that was my own personal experience. About the same or better over time. And this is, we are a broad group of folks in terms of what we're doing and what that means. Over time, we change roles over time, our programs change. So recognizing that exactly what that means for each one of us as individuals is going to be very, very different. I think it just highlights, though, to me that it doesn't inherently just get easier as we have more resources and able to do stuff. And again, in my experience, it got harder, and it sounds like for some of you it has as well. So yeah, just kind of rounding out. So this is essentially us rounding out, kind of talking about all this background, and then we're going to talk about some strategies. But just re-emphasizing, circling us back that this is all real, right? The work has a real impact. It has an impact on us, it has an impact, and that impact on us impacts animals, the people that we work with. So just re-emphasizing that. So this is a very informal survey that Dr. Julie Levy from University of Florida, I think actually put out on the ASV Facebook group. And so this is not, and it actually might be a little hard to read for you all, apologies. This is not a big scientific peer-reviewed survey, but I think it lends kind of into us talking some of the strategies to support ourselves. Looking at why veterinarians are staying in shelter medicine. So again, this is specific to veterinarians just because of who the audience was for this. But basically, the folks were staying, but they felt like they were making a difference, right? Like we highlighted that at the beginning, and many of you feel that way. When our input felt valued, when there was a good relationship with management and with the others that we were working with. And the converse, to a lot of that was what caused folks to leave the field. And the reason I throw this up there is not necessarily to get into each one of those as individual, but just to highlight some of the big picture stuff that impacts our well-being. So as we go into talking about strategies, which is going to be kind of us going forward, again, and a lot of this is talking about, like, again, animal decision-making strategies, although there might be some things that pull into other aspects of decision fatigue in ourselves and our own time and our own people. So there's stuff that we can do personally, and as I mentioned, we're not going to get into some of the more really focused and well-being strategies that are outside of our work, in our mindfulness and in our way to support ourselves. But there are those personal strategies, and there are personal strategies in terms of how we bring ourselves to the work. And there's organizational strategies, right? Like there's the budget, there's the staffing infrastructure, there's the way that there's the operational decisions, there's the mission, there's all of that comes on the organizational side. And in my approach to figuring out which kind of strategies to distill down into, I was trying to find sort of a little bit of a happy medium. Again, we're not going to get into the stuff necessarily that you can do for yourself at home, nor are we necessarily going to get into the stuff you would need to really be a leadership role in your organization to impact organizationally. Partially because I know not everybody out there is in that position. Also, partially, I think to your point when you brought up decisions related to staff, that's tough stuff, right? Like that can be hard to affect that change. And so we are going to talk a little bit communication and how, if you are in a position that you're not in that sort of organizational level decision making, how you can bring yourself to those conversations. Some of the techniques we'll talk about with collaborative decision making apply, but we're largely going to focus on what I hope is a sweet spot in the middle. So things related to how we can bring ourselves to the work each day. So we have that ability to affect that because it's how we bring ourselves. And then also some that is a little bit more infrastructure related in terms of how we're making decisions in the sheltering environment, but not necessarily like the big picture how an organization is run. So what we're going to focus on is 3 main buckets for decision making. One is, and this is the most personal of them, is talking about having a growth mindset. The other one is talking about collaborative decision making. And I want to just say right up at the front, and we're going to talk about it again, I know that many of us are in very different sized organizations, right? So some of you may have big teams that you're working with. Others you might be like, well, collaborative's all good, but it's all me. And so I think that some of those will apply a little less if that is your role. I hope that there's still stuff to gain, and I just want to acknowledge it up front that we're all coming from different positions in terms of like who we're making all these decisions, intake, outcome decisions with. And then our most sort of operationally practical thing that we'll round out with is talking about the platforms and tools for decision making that can be support for us. So before we go into the break, the only strategy we're going to talk about before we take a break, so y'all can, go see if there's any coffee still out there and whatnot, is to talk growth mindset. And this is probably the most touchy-feely portion of the segment, but it's something I think is so important. And it's funny because growth mindset as a term is something that my daughter, who's now 12, it was like the theme of her elementary school was having a growth mindset. So I know it can be used in a lot of different ways. And I as a cynical, droll New Englander, sometimes have an aversion to some of the sweeter terminology. I think this one stands because I feel like it's so important for us because we put such pressure on ourselves to like always do it and get it right? Because there's high stakes, because we have a lot of folks looking in on everything that we do, but we're human beings, right? Like we are gonna make mistakes and we are not always gonna get it right. And that's because we're human, right? Like it will happen. And as a veterinarian, that's where most of my lived experience is with mistakes. And some of that has nothing to do with decision making. When I give a session on well-being for veterinary students, the example I give is surgical mistakes and having had animals die because I made a mistake in surgery. And that is not because I was a horrible surgeon. I don't do surgery anymore, but that's not because I was a horrible surgeon. It's because I'm a human being and mistakes happen. And they are opportunities for growth. And that is very easy to say up here in a session, and it's very hard to live, but it is true. But successful decision makers, successful whatever your role is, don't make less mistakes, right? Because you are all human and you are being asked to do a lot, and you're being asked to do a lot all the time, and you will make mistakes. Successful decision makers learn from their mistakes. They just make new mistakes next time around. I don't know if any of you have kids or if you just like Pixar Disney movies, but Zootopia, there's a song at the end by Shakira, and one of the like repeated refrains in the song that I made my daughter listen to, she grew to hate it, but it's just basically like, I'll keep on making new mistakes. And I think that's such a powerful thing. And I say I harp on this a lot because I've had to tell myself this a lot, that just because I've messed something up, and what that can look like can be very different depending on our roles, doesn't mean that I am bad at it. It's how I react from that and how I try to learn from that, or how I recognize that sometimes like it just happens. And along those lines, it's not always a mistake, right? Like when things don't go well with a decision that we make, sometimes it's just because we cannot predict the future all the time. We don't know if that intake decision that we are making or that animal that we are choosing to pursue treatment for, we can't always tell how that's going to go. We don't know how that, I mean, there's been a lot of talk. I haven't been able to attend all the behavior sessions, but certainly there's been a lot of emphasis on like, we don't know how that animal is going to do in that environment and in that home. We are in the business of making educated guesses all the time based on limited information. We don't know if that animal that we're going to transfer in from our partner is really going to be the best use of our resources or not. We are making an educated guess. And sometimes we're going to get it wrong, or sometimes we just can't predict, and it just is the way that it happens. Sometimes we will adopt out the cat with the heart murmur and they will die shortly after adoption. Every time there is a specific scenario, you can tell that it comes from reality. And we have to accept that, and it sucks, right? Like if we have the dog that we've adopted out and they've bit somebody, and if it's a bad bite, like that really sucks. And sometimes we can learn from it and do something differently. And sometimes it's just is what it is. It doesn't mean that, because I've had that scenario happen where I've had a cat with just a heart murmur that, had a clot and died. It doesn't mean we should never adopt out those animals again. But it does mean that sometimes we can learn from it. Sometimes there's something you can do from it. And so in addition to treating mistakes as learning opportunities, treating when things don't go as planned, and Sheila certainly very much, I love the way that she emphasized it last night in the keynote, using that as a learning opportunity, but recognizing that it will happen and it doesn't mean that you're doing things bad, and taking some of that burden off yourself, I actually think is very hard to do, very easier said than done, but is a strategy towards helping yourself with decision fatigue, at least for these big decisions, with cutting yourself some slack, that recognizing that you are making an educated guess. So like, no matter how much you try, you're not always going to get it right. When it does go wrong, do it, see, is there anything I can learn from that? Or is that just like, sometimes it happens? Debriefing when things don't go right. And again, that's going to depend on the scope of it or what happened, but talking about it with folks. And that can be your team. If you're at an organization that you have a team that you're working with, if it's all you running the show, it can be with your colleagues outside of your organization, using each other. And that's going to be a big message round 2 as a teaser, using each other as a support network to debrief on when things don't go right. And then sharing and learning with each other. Now, a lot of that, we're going to talk communication strategies, because relying on each other, working with each other, relies on some communication tools to make that supportive, rather than, find that sometimes with less positive work relationships that can, it can be more toxic than it can be supportive. So that requires some work. This is not all just like easy peasy, like, oh, okay, done. But I think it's really, really key, because I think sometimes why decisions were so hard is because I was putting too much pressure on myself for each one. And so it's about just owning that, like, we're just not going to get it right all the time. And it's just that is the situation that we are being put into. And so acknowledging that, so that that you can take a little bit of that burden on yourself, off of yourself, to try to always be perfect with everything that you do. On that note, I'm going to let you all take a 10-minute break. Oh, 15, sorry. No, you can take longer then. And we'll talk more strategies to approach decision making when you get back. Thanks all.